Whoa, that's new. All right, well, so I'd like to welcome Bert Russo. I got to know Bert when she was in leadership Little Traverse. She was a student. She actually told me the year. She was in the class of 2011. And so obviously I got to develop a friendship with Bert at that time. At the time, she's working for Northern Community Mediation, but these days she is working for Charlevoix Probate and Family Court at the court school. And she serves as really the administrative assistant for the program, but leads their foster parent program. And that's what she's here to talk to us about today. She's a former Army reservist. I think she's lived in Petoskey area for more than 20 years. When she got married, she came up to this area, and we've been lucky to keep her ever since. And she's a lovely person, and like I said, a good friend, and that's nice to see her again. So welcome back, Bert, and thanks for being part of our program.
Thanks, Carlin. That was a very nice introduction. Thank you. And it's good to be here. Like Carlin said, I do work for 7th Probate Family Court, and I do work for the court school. The court school has a couple different facets to it. One is the regular school part. The academic part is where, you know, the kids around the area are suspended or expelled, and they come and continue their education with us. The other part is the Safe Harbor Adolescent Recovery Program. And that's a court-administrated, trauma-informed, co-ed adolescent substance abuse treatment program. And I know I'm here to talk to you about fostering, but I needed to kind of fill you in with what our program is, because our foster care is a little different than normal foster care. So Safe Harbor is a collaborative approach to the youth with treatment providers, academic partners, and court licensed foster homes. The youth that we take in our area come from all over the state. And when they come and they're placed in the Safe Harbor program, we put them into a foster home. Our program is one of the least restrictive styles of inpatient services accessible through intensive outpatient care. And that's why it's so important for our foster homes to continue to build and grow our foster homes. Our vision statement is to increase public safety by providing a comprehensive system of treatment services, judicial supervision, and integrated of the court and community service, which results in the reduced recidivism rates, increased school attendance, and increased employability and sobriety while protecting the rights of the juveniles. Our mission statement is to provide the best clinical practices to serve individuals and their families in the treatment of co-occurring conditions. Our integrated treatment program is designed to meet the multifaceted recovery needs of individuals with co-occurring issues, both mental health and addiction. And we offer a variety of evidence-based treatment practices. Currently, we have a contract with Harbor Hall who provide those services. We serve both male and female between the ages of 13 and 17 years old. These youth have to have a diagnosis of a chemical dependency. Most of our youth are court referred, and that's pre or post adjudication. They have to have no history of no history of violent criminal offenses. They need to be mentally and physically capable and willing to participate in the program. The typical length of stay for our program is 6 to 8 months, with the youth moving through 4 different stages of the program. We call it the freshman, sophomore, junior, and senior phases. At their senior phase, we have them present a project, and they can choose whatever project that is, but we want them to reflect from when they first came into our program to where they are now. It's a good reflective program or project for them. So they really reflect on what they've done and what they've accomplished. We also have an extension of our program. Once they're completed the program, they usually go back home. Sometimes our youth aren't ready to go back to their home for whatever reason, their environment or or their parents haven't done what they're supposed to do. And that's called the extended recovery care, where the kids then get more freedom. We have 3 components to the program. One, of course, is recovery, which are the group and individual sessions. We do home visits with the families. Obviously, the goal is reunification so they can go back home as soon as they've completed the program. And then we also involve the parent counseling and training, because we also know that these kids, if we can get them on the right track of being sober, their parents need to understand there's some changes that may have to occur in the home as well. And then the second component is the academics, the credit and the credit recovery. Most of our youth come with the need for credit recovery. And again, the third component is the foster homes, and that's one of the reasons why I'm here today is, but our foster homes are key to our program. It's where the youth use their recovery skills that have been taught here with counseling and the group sessions and the academic part. But it's really when they go back home and out into our community, they're able to use those skills that they've learned with recovery. So again, our foster homes are key to our program, and we're in need of them. We're in need of more foster homes. I know all of you know this, but what is foster care? It's a temporary care for youth while working with a safe harbor as a team. And again, the goal is to reunite the families. And part of that goal is to help mend relationships with their family and friends. Oftentimes when the youth really do reach our program, a lot of those relationships are severed. Parents are at their wits' end and they just don't know what else they can do. A lot of times there's the trauma with oftentimes the parents themselves suffering from some sort of addiction. One of the other goals is to provide a home environment with the opportunity of growth and sober living. As I mentioned before, we're a little different. Our foster homes are not designed because of what the parents have done. The kids are removed from the homes based on their own actions and their desire to continue to use any kind of chemical. It's not usually a neglect and abuse case. When you hear foster homes, that's usually where the fostering comes in, as the kids are removed from the parents' actions. But ours are not. It's different because the kids are removed because of their actions, and our kids are in need of more supervision because of that. Charlevoix County 7th Probate and Family Court is an approved government unit that is authorized to certify foster homes for licensing. All of our homes are licensed through the Michigan Department of Health and Human Services, the Division of Child Welfare and Licensing. So all of our fostering is the licensing part, and the guidelines all fall under the state rules and regulations. Our foster homes, we do pay a per diem, a daily per diem rate of $55 a day, which is a lot higher than some of the other agencies that do fostering. Those $55 are that helps cover incidentals and part of their meals, because if you wanted to take them to the movies or a ball game, that's where that $55 are. It's not difficult to become a foster parent. The guidelines from the state state that you have to be 18 years or older. You can be married or single. If you're married or have a significant other, both parties or adult households in the member have to agree to be foster parents. Both do sign the agreement to do that. Your income must be adequate to meet your own family needs. Obviously, the state wants to make sure that you're doing the fostering for the right reasons and not that you're here to make money. And I'm here to tell you, you're not going to make money being a foster parent, because I think the rates are too low, but that's my own opinion. You can own or rent. You can be in an apartment or a house. The guidelines are as long as we can meet the square footage for each child in your home. Be of good moral character, and that basically means that you don't have any serious criminal issues in your past. and that the person generally fulfills the obligations under the law. You have to have an expression or a willingness to provide care for the children that we serve at the agency. Demonstrate an understanding and willingness to learn how to care for these youth that are in our homes. We help all of our foster parents do that. We have weekly team meetings. Hopefully we're going to start doing those in person soon, but we do have the weekly team meetings. You are part of the team. And I tell the kids, you know, we meet all together to talk about you, and there's no secret about that. We talk about, you know, we have our educators, our counselors, and then our foster homes along with the admin staff, so that we are able to meet the needs of both not only the youth, but also the needs of the foster home, because there are difficult situations, and I really pride myself into being that supportive person. I give all of our foster homes my personal cell phone, and there's been many times at 9 o'clock or 10 o'clock, I get a call and I'm there, because sometimes we just need to brainstorm what's working, what's not working. You need to be a physical and mental capability to be able to provide for the children, and be residing in the states legally. The process is lengthy, to usually from start to finish with an applications is 6 to 8 months. And that's providing everything goes smoothly. There's a lot of correspondence that goes back from our office to the state that comes back. So there's a lot of back and forth. But it is a lengthy process. It's very detailed, very in-depth. I get to know the foster parents very intimately with the questions that I need to ask. Everything that's told to me is confidential. There's the state obviously has certain things I have to report on, and I do many lengthy reports to the state, but it's not shared with anyone else. It's very confidential. You are fingerprinted. There's obviously a huge and extensive background check that the state does. If you live where there's a septic, we come and have the septic inspected. The state actually pays for that inspection, which is kind of nice. We ask for 3 character references from some of your friends and family. We do interview them. We interview your family. We interview everybody in the household. The whole household has to have a physical to make sure that there's nothing hindering your ability to provide care. But the most extensive is the home evaluation. I do come into the home several times. And once you're licensed, I do make an annual visit where I do inspect, and I make sure that you have running water and that there's food in the refrigerator for the kids, and that everything is still in accordance with the state guidelines. Again, you're part of a team. We have the weekly team meetings, and again, I give my phone number, so I'm 24/7 at your call. So if, I'm kind of trying to wrap this up so I leave time for questions, but if you know of anyone who's interested in becoming a foster parent or learning more about it, I can give my contact information, because I'd love to talk individually. And then there's an orientation before the application process. But so I'd like to open it up for any questions, if I could, if there's any out there.
So Bert, this is Carlin. If you're a foster parent, are you restricted on, like, I mean, are you watching this child 24/7? Like, can you go out to dinner or something, you know, and leave the child alone, or do they need to be watched at all times? And
yeah, but that's a great question. With our youth, when they're in the program, they need to be watched 24/7. And that is because of their history of use. These kids come drug seeking. And so we don't allow them to be left alone. We do offer respite care. So if you wanted to go out, and it's important to continue to have your relationship with your family too. So we encourage those, we call them breaks. So if you needed a break and wanted to go to dinner or go to the movies and not include them, then we have a respite care worker come into your home and for lack of better words, babysit the youth. But yeah, these youth have to be watched and monitored. When they go into our extended recovery program, again, that's after they've completed their sobriety program, then they're allowed to have those extra freedoms so that, you know, if you needed to run to the store or whatever and didn't want to take them, they could be left alone. But initially they need to be monitored.
Bert, now you mentioned the respite care. Is that a volunteer thing? Like, say if somebody maybe didn't feel that they could take on the full responsibility of foster parent, but they could be a respite volunteer, or is that only for a paid position?
Nope. The respite care does get paid. And that's between the foster parent and the respite care worker. But if you're interested in becoming just a respite care, again, there's a little process that the court does. You have to have a background check to make sure there's no criminal history and that, you know, the youth are safe. And then we kind of help train you to help watch these kids, because they're young people who've made some poor choices, but trying to get them on the right track sometimes is a little challenging.
What kind of turnover do you have of the foster people? You know, how many quit after one assignment versus longer term people?
And, you know, we've never had a foster parent quit after the first. And I can give you one example. We have a foster home who has been with us since this program started back in 1989. And she convinced her daughter that it was something that she loved so much that her daughter thought she'd try it. And so they've both have been with us. I couldn't even tell you how many years. I know that Marty's been with us since 1989. So usually with our foster homes, once they start, they're with us. Now, this isn't for everybody, and that's usually what we do through the programming and the training. Most people know whether they want to do it or not before the application gets processed.
Thanks.
And Carlin, I'm sure we'll have your contact information and can put that in the Rotary Spokes, and people will read it this week.
Awesome. Well, I just want to say thank you for allowing me to speak. Again, it's not an easy task, but it's a very rewarding one. So again, if you're even thinking or considering, I'd love to talk to you a little more. Again, we do an orientation that's a little more in depth with everything. And so thank you, everybody.
Thank you.
And I did it before 8:15.
With a minute to spare. All right, thank you. I'm going to stop recording. And then